It's become this political flashpoint over the years, but in actuality, it's really a set of practical strategies to reduce the harms of use.
Okay, harm reduction is nothing new in Multnomah County. The approach is meant to help people struggling with addiction, allowing them to do drugs safely with the idea that eventually they reach recovery. Now, those running a booth at OHSU Farmers Market this morning are advocates of the practice. Today, they handed out free naloxone, the overdose reversal medication, and gave lessons on how to use it. Experts say harm reduction saves lives, given how deadly drugs like fentanyl have flooded our streets in recent years. Here's Honora Englander, a professor of medicine at OHSU.
I think it's unquestionable that harm reduction saves lives, and we know that harm reduction really is a set of practical strategies and also a core philosophy that's really rooted in sort of a respect for and understanding of the experience of people who use drugs.
Groups that work in harm reduction often hand out naloxone like you just saw. Some also give out safe smoking supplies like foil, pipes, and straws used for smoking fentanyl or meth. And there's also needle exchange programs. Those are free, clean syringes for people who inject drugs. We met a man named Michael in Portland's Old Town neighborhood today. He's addicted to fentanyl and tells me having clean needles keeps him and others safe.
I think it's good, actually. I know it's good. I've seen people digging in the dirt for needles in states where they don't have harm reduction, but here you can just there's it sounds awful, but there's needles aplenty. People can get clean needles and they're not sharing them, and some people can't get enough meth while smoking it, so they got to shoot it up.
Multnomah County has funded these harm reduction efforts for years. In this year's budget, $6 million went towards the practice. The county says that $6 million covers more than just drug supplies. It also includes counseling services, overdose prevention education, and sexual health services, with a target of reaching 8,000 people.
They're going to get needles somehow, and it's definitely, this is the best way to do it.
If you didn't have like the free needles, would you stop using?
No, that's not how that works. People are going to use regardless.
A spokesperson for the Multnomah County Health Department told me today, we are not changing evidence-based public health practices that help keep people alive. Recovery and harm reduction are not mutually exclusive. Harm reduction prevents overdose deaths and the spread of communicable disease, ultimately improving people's chances of finding stability and recovery. Now, as you might imagine, there are people here in Portland and beyond who do not support this work.
If they think harm reduction, quote unquote, which is harm destruction, is a good idea, then they're out to lunch.
Todd Littlefield is part of the Lentz Neighborhood Livability Association and sees the side effects of the addiction crisis daily.
So if we're enabling them, providing them, handing out these drug supplies, what's the incentive? It's destroyed the neighborhood and it's destroyed Portland.
All right, take a look. These piles of tree limbs, Todd put them there to try and stop people from setting up tents outside his Southeast Portland home. He also plays loud music from a speaker on his garage to make it harder for people to sleep outside. As for drug use and drug supplies, yeah, he sees that too.
Well, I had a gal once drop off 3,500 needles on my property, and I asked her what she was doing. I said, clean that up. She left the boxes behind. They contained 100 needles per box. There's 35 boxes. There's tinfoil everywhere. There's needles everywhere. What are these people doing with it? They're doing drugs that will eventually kill them. Well, I think it's backwards. I think harm reduction is a very clever and evil term that it means the opposite of what it is. I mean, you're perpetuating and enabling the eventual death of these people.
I understand where that perception may come from, but harm reduction is not an enabling crisis. We're not encouraging people to use drugs. We're supporting people's real needs in that real moment.
Okay, let's take a step back and look at what other cities are doing when it comes to the addiction crisis, because this is not just a Portland problem. Across the country, communities are turning away from harm reduction efforts and moving toward recovery-first models instead. That's according to a New York Times article published this week that we think is worth your time. Jan Hoffman is a health reporter covering drug addiction for The Times. She writes, cities move away from strategies that make drug use safer. San Francisco, Philadelphia, and others are retreating from harm reduction strategies that have helped to reduce deaths, but which critics, including Trump, say have contributed to pervasive public drug use. San Francisco's new mayor has banned city-funded distribution of smoking supplies in public places like parks, while expanding treatment centers and recovery housing. Philadelphia stopped funding syringe programs and made it harder for mobile outreach teams to give out overdose reversal kits, while increasing police presence in areas with open-air drug markets. And parts of California have also shut down syringe exchanges. That's according to the Times article.
They're on the right path. And Multnomah County has failed the city of Portland, the residents of Portland, and the people that are doing drugs. Absolutely failed them.
And this is my professional opinion, not the opinion of OHSU necessarily. I think that those policies are going to have real harms. And I think that we need an array of approaches and an array of policies. You know, treatment and accessing treatment there are a lot of barriers for people. And those barriers really occur at a whole wide range.
Last month, President Trump signed this executive order titled Ending Crime and Disorder on America's Streets. In it, he criticized harm reduction efforts and threatened to pull federal funding from groups that support it. The executive order reads in part, ensure grants issued by the Substance Abuse and Mental Health Services Administration fund evidence-based programs and do not fund programs that fail to achieve adequate outcomes, including harm reduction or safe consumption efforts that only facilitate illegal drug use and its attendant harm. The president also wants to support expanding drug courts and mental health courts, while directing the Attorney General to review federally funded groups that knowingly give out drug paraphernalia to see if they are in violation of federal law, and if so, freeze their federal funding. But let's go back to Michael, the homeless man I met in Old Town today. Harm reduction efforts are meant to help people like him. However, he says he's been on the streets for 10 years, and while he knows where to get drug supplies, he doesn't know where to get treatment, even if he wanted it.
The free supplies don't really offer recovery. They just offer a clean solution or whatever, like for using your drugs or whatever.
Yeah.
I don't know where to get clean. That's why I'm out here still. So.
Okay, let's hear it. What do you think about harm reduction efforts? Do you support it? Why or why not? Let us know. Email the story at kgw.com or call and leave us a voicemail, 503-226-5090.